Over the recent days, we have learned of a significant number of growing cases linked to travel with Nigeria. There are 27 cases already in England, and that's growing. And Nigeria now is second only to South Africa in terms of linked cases to Omicron. So today, the government has decided to add Nigeria to the travel red list, and that will be effective from 4 a.m. on Monday, which will mean that only UK citizens or residents of the UK can enter the UK from Nigeria from that point onwards, and they will have to quarantine in one of the relevant hotels. We have also decided to require pre-departure tests. That's for all inward travellers. That will be effective from 4 a.m. on Tuesday, and they will be required a maximum of 48 hours before the departure time. We've kept the data under review over the last week or so since we learnt about Omicron, and we're seeing increasing number of cases linked to travel. And again, we've always said we will act swiftly if we need to, if the changing data requires that, and that's why we've decided to bring in this change on pre-departure tests. Now, I will stress these are temporary measures. We want to remove them as soon as we possibly can, but before we learn more about Omicron, it is right that we have these measures in place.
And with the pre-departure tests, so Labour's called for them, Sage spoke about that being a sensible idea at the start of the week. Why the wait?
I think it's really important at a time like this to have a balanced and proportionate approach. The measures that we introduced around this time last week, which were around the PCR test, the day 2 PCR test when everyone arrives back in the UK and self-isolating until you get a negative result, and some of the other measures around red listing countries, I think they've been the right response. But when the situation changes, if it requires more action, it's absolutely right the government acts swiftly. I'm afraid there's no further update to this point. We are still working actively, both our scientists here in the UK, working with their international partners. Just yesterday, I had a call with the head of the World Health Organization, and we're working closely with all our international partners to learn what we can. I think people should carry on with their plans, and they should make plans to enjoy Christmas as usual. The guidelines that have always been there are still there, the ones we set out a few months ago, even before this variant. Of course, we've known all along that COVID and flu, for that matter, it likes the darker, colder days that winter brings. So just follow the guidelines that are there about hand hygiene and having ventilation where you can, but most of all, enjoy yourselves. We'll keep the situation under review, as we've always said, but I think that today's action again shows that whenever the government needs to act, we will.